Okay, today we're going to talk about the maxillofacial prosthodontics. First of all, these two definitions are according to the GPT 90 edition. The maxillofacial prosthetics was defined as the branch of prosthodontics concerned with the restorations and replacement of the stomatognathic and craniofacial structures with prostheses that may or may not be removed on a regular basis. And the maxillofacial prosthesis is defined as any prosthesis used to replace and craniofacial structures. Now, the maxillofacial prosthesis for thousands of years, as mummified Egyptians were found with silver eyes as well as nasal and auricular structures. And the Chinese were known to fabricate nasal and auricular prostheses using natural waxes and resins. And also the Byzantine Emperor Justinian II, who was known to have a prosthetic golden nose. Now, the aim of the maxillofacial prosthetics, the main prosthesis aim is to restore the patient's aesthetic and function, which ultimately enhances the patient's self-esteem and quality of life. And also it has a role in the protection of the tissues and a role in the psychological therapy and the state of mind of the patient. Okay, the maxillofacial defects can be divided into intraoral and extraoral defects. مثال على الانتراoral defects ممكن يكون بالماكسيلا or the mandible, in the hard or soft palate and the tongue and floor of the mouth. أما بالنسبة للextraoral defects ممكن تكون بالear or nose or lips, and ocular defects and midfacial defects. According to Chalian's classification of maxillofacial prosthesis, he divided or classified the maxillofacial defects into congenital and acquired defects. Congenital defects such as the cleft lip and cleft palate and other syndromes and developmental diseases, will acquired defects such as the trauma, surgery, and pathology, such as tumors or neoplasms. خلصنا من maxillofacial defects classification. these are the maxillofacial prosthesis classifications. ممكن تقسم إلى intraoral prosthesis, extraoral, and combined prosthesis. The intraoral maxillofacial prosthesis ممكن يكون maxillary obturators بالنسبة للماكسيلا and mandibular defect prosthesis. الextraoral ممكن يكون nasal, auricular, and orbital prosthesis. أما بالنسبة للcombined such as the nasomaxillary prosthesis and the orbitonasomaxillary prosthesis. The maxillary obturators. An obturated prosthesis is required for patients with hard or soft palate defects coming from the cleft palate or tumor resection or facial trauma. The goal or the obturator prosthesis serves to restore the continuity of the palate and separate the nasal cavity and maxillary sinus from the oral cavity. And patients who undergoes the maxillary resection, usually due to tumors or trauma, is rehabilitated in 3 phases: immediate, interim, and definitive obturator. بالنسبة للimmediate surgical obturator, this type of obturator have a very simple design and easy to be fabricated in order to achieve its goal, which is usually to support the surgical packings in the resection cavity and to restore the palatal continuity and close the surgical defect and prevent the hypernasal speech and the nasal refluxes. Usually, this type of obturator is fabricated without teeth and without the extension of the obturator into the defect. The modes of retention for this type of obturator for dentate patients is obtained by simple clasps, and for edentulous patients, it can be wired to the zygomatic arch or sutured into the buccal vestibule or screwed in the alveolar bone for retention. Usually this prosthesis will be used or will be in service for approximately 5 to 10 days. The interim obturator, the same immediate or the surgical obturator can be relined bit by bit with a tissue conditioner. So it will take the shape of the defect, and then it can be used as a wax pattern in order to be flasked and processed into the interim obturator. And the rapid changes and the contraction of the soft tissue after the surgery, usually the patient is reviewed every 2 weeks for the adjustment and reline of the prosthesis because of these changes. And when tissue changes are less rapid after 1 or 2 months after the surgery, the prosthesis can be flasked, replacing the interim lining material. And in this stage, the maxillary anterior teeth can be added for aesthetics. And another way of fabricating the interim obturator without the use of the immediate obturator by simply using a viscous alginate impression and fabricating it using heat-cured acrylic. The definitive obturator is defined as the prosthesis that artificially replaces part or all the maxilla and the associated teeth lost due to the surgery or trauma. And this is usually fabricated when the tissue healing and contraction is completed and stable, which is usually after 2 to 6 months of the surgery. بالنسبة للmandible, there are 2 types of defects that form after the resection of neoplastic lesions in the mandible: marginal mandibulectomy and discontinuity resection. Marginal mandibulectomy involves the resection of the mandible while preserving the continuity of the mandibular arch. This type of surgery can result in significant defect that impact the mastication, speech, and appearance, necessitating prosthetic rehabilitation. The discontinuity resection happens when the excision of the defect leads to complete separation of the mandible. And usually treating the mandible is more difficult than the maxilla in establishing good stability and retention. And the treatment of choice for this kind of patient is to do surgical reconstruction with bone grafts followed by implants to anchor a fixed or a removable prosthesis. But some patients, the surgical rehabilitation is contraindicated. So a prosthetic rehabilitation with complete dentures, removable complete dentures, and removable partial dentures is performed. 3D printing for custom facial prosthesis. This is a case report of a patient who lost his left ear due to trauma. And a digital workflow was used to fabricate a prosthetic ear. First of all, a digital scan was obtained for the healthy ear and the ear with a defect using an intraoral scanner. Then these 2 scans were exported into a 3D modeling software, which was Mesh Mixer. And the software used to invert or mirror the normal ear on the contralateral side using an artificial marker placed on the tragus of both ears to have the best match between the 2 scans. And once the final design was meshed and the final margins merged with the surrounding area, the inverted copy of the normal ear was 3D printed in resin. And this ear template was fitted into the defect area to verify the fit and the position, and any adjustments were made. Now, in order to take the color, the skin tone and color of the patient, an eScan spectrocalorimeter and eScan calculator were used, and the eScan uses a digital library of nearly 20,000 skin tones to match the patient's skin for prosthetic applications. كيف بيستخدم? This eScan instrument measures the skin color and instantly displays on its screen a matching coloring recipe. وغير عن الcoloring recipe كمان بيعطي the weights of the part A and B of the silicone that are required to be mixed with the colors. Then the mixed silicone and colorants were poured into a mold in which was then invested and processed, and the final prosthesis was finished and adjusted and secured in place with medical adhesive, as you can see in the pictures. The final result. This is another case report where they used a facial scanner and an intraoral scanner to acquire a digital scan for the best fit and best details for the fabrication of an orbital prosthesis. In this case, the patient was seated upright and the facial scan is acquired. Then a scan of the healthy eye is acquired using an intraoral scanner. And the two scans are matched by choosing the optimal matching according to the color map, deviation map, sorry. And in the matching area, the data acquired by the facial scanner was replaced by the data acquired with a more detailed intraoral scanner. Then the 3D model of the healthy eye was separated and mirrored to the contralateral side using the facial median sagittal plane. The mirrored part was adjusted to achieve the best symmetry with the contralateral facial morphology. And then a negative mold was designed from the scan on the defect area, the mirrored one. A negative mold was designed and fabricated with polyamide by using a 3D printer. Here in this case, a stock ocular prosthesis was used, and then the silicone base was mixed with the catalyst to initiate curing, with the pigments were added to match the patient's skin tone. Then the mixed silicone is poured in the mold cavity that was 3D printed, and the prosthesis was processed. Finally, the excess flash is trimmed and the orbital prosthesis is delivered to the patient. Now the advantage of this method is that it provides both the overall facial topography from the facial scan and the details of the healthy eye by the intraoral scanner. And now the details scanned by the intraoral scanner could reproduce the skin surface textures of the patient. So later on, additional manual sculpture is not necessary in this workflow. And also this method, along with the 3D printing, results in an excellent prosthetic outcome and saves time and labor compared with the conventional method. Current materials for maxillofacial prosthesis. The currently available materials are acrylic resin, acrylic copolymers, polyvinyl chloride and copolymers, polyurethane, and silicone elastomers. هنحكي عنهم بالتفصيل وكل واحدة والادفانتجز لها والdisadvantages. acrylic resin من الادفانتجز تبعونها انه this material is available and cheap and most dentists are familiar with the processing technique of this material. This material also can be relined easily and the extrinsic and intrinsic coloration can be utilized with acrylic resins. من الdisadvantages for the extraoral prosthesis, its rigidity تبعتها بتمنعها انها تستخدم مع movable tissues, انها بتعمل discomfort للpatient and exposes the margins. Acrylic copolymers, these materials expand, so the molds are underfilled by 10%. The advantages تبعونها انها soft و elastic, but it did not receive a wide acceptance due to the poor edge strength and poor durability, وبصير لها degradation مع sunlight وعندها الهاندلنج تبعها is difficult. Polyvinyl chloride and copolymers. بالعادة الفينيل resins are relatively rigid لكن خلوها flexible by the addition of the plasticizers فصارت more flexible. And this material also can be adaptable for both the intrinsic and extrinsic coloration. من ال disadvantages تبعونها انها هذا metal molds had to be used for the curing and processing, which are expensive, and it exhibits a poor tear strength and color stability, and it loses its flexibility with aging. Polyurethane elastomers. Polyurethane elastomers has an excellent properties like flexibility and good edge strength, and can be colored extrinsically and intrinsically easily, and has a good aesthetic results. لكن من disadvantages إنها moisture sensitive. إذا كان في أي moisture أو water gases in the molds حيصير فيها bubbles وتعمل defects. And also it has a poor color stability. Silicone elastomers. Silicone is made of alternative chains of silicon and oxygen. وبنصير احنا نعمل لها modifications by attaching various organic sides groups on the silicon atoms or by cross-linking the molecular chains. عشان هيك احنا بنغير الخصائص تبعتها. They exhibits a good physical properties over a range of temperature. ممكن تنقسم إلى heat vulcanized or room temperature vulcanized. اوكي. ترى ضايل 10 دقائق نكمل ولا استنى شوي ولا؟
Okay, إذا كنت this is the halfway in the
تقريبا.
lecture
Yes.
slides. Okay, we can stop here and take a 10 minutes break and continue. So we will have all of the elastomers together. How many more about elastomers?
يعني مش كثير عن الالاستومرز. ممكن انه نكمل الالاستومرز بعدين نحكي عن الامبلانتس.
Yeah, okay. Yeah, fine.
اوكي. كده بنقسمه الى اللي هما الهيت vulcanized and room temperature vulcanized. الهيت temperature vulcanized silicones هم عبارة عن white opaque and viscous material having a putty-like consistency. ممكن تكون in one component or two component systems. various amounts of fillers ممكن إنها تنضاف على هذه الماتيريال حسب ال degree of hardness and strength and elongation that is required. Vulcanization in the heat temperature vulcanized silicones occurs by the free radical addition, and the process ranges from 180 to 220 Celsius for about 30 minutes under pressure using metal molds. هذه طريقة البروسيسنج للهاي temperature vulcanized silicones. They have an excellent tear strength and highest tensile strength, high percent of elongation, and excellent thermal, color, and chemical stability, rendering it more biologically inert. أما room temperature vulcanizing silicones, they are very popular and the most commonly used because of their good physical properties, and also they are easily processed. بنقسموا لقسمين اللي هم الكروس linkage occurs يا اما by condensation reaction or by addition reaction. اللي بيصير لهم cross linking by addition reaction they must be heated to يعني مش room temperature بيعتبروا. They must be heated to 150 Celsius for an hour. Now, the recent advances in the materials, especially in the elastomers, زي silicon block copolymers, this material is under development to improve some of the weaknesses of silicon elastomers, such as the low strength, tear strength, and the low percent of elongation, and the potential to support bacterial or fungal growth. It was found that this material undergoes surface modifications, which improves its tear resistance compared with the conventional cross-linked silicon polymers. This second material is MDX4. It is a low-temperature vulcanizing silicon polymer provided as a two-component kit. And polymerization reaction is by addition. with no byproducts. It has a high tear strength compared to the room temperature vulcanizing silicones, and thin edges can be designed in the prosthesis without the risk of damage during wear and removal. And it has a better color stability than the room temperature vulcanizing silicones. Polyphosphonazines. These materials were originally developed to be used as a resilient denture liners, لكن المodifications of the physical and the mechanical properties of this material enables it to be used in the fabrication of the maxillofacial prosthesis. Cyphenylines is another siloxane copolymers with phenyl and methyl groups and exhibits significant improvement with respect to edge strength, coloration, and low modulus of elasticity relative to the other room temperature vulcanizing silicones. Dora, should I stop here?
Yes, this is another subject. We can have a 10 minutes break and we'll come back to that part. Thank you very much.
تمام.